Resistant nephrotic syndrome is defined as nephrotic syndrome not going into remission with conventional steroid at 60 mg per square meter or 60 mg total daily dose by 4 weeks is called resistant nephrotic syndrome. In fact, your 10 to 30% of the childhood nephrotic syndrome are resistant. So at 4 weeks, you defined it as resistant nephrotic syndrome. By another 2 weeks, you will do three things. One, you will go for the renal biopsy. Two, you will go for the genetic test, and you talk to the patient's parents about the nature of that treatment we are going to opt now. So by 6 weeks, you have labeled the resistant nephrotic syndrome in full. You have gone for 6 weeks oral prednisolone or 3-methylprednisolone. By last 2 weeks, you can have 3 IV-methylprednisolone. Then you have the test done. You counsel the patient parents, and you have your next options of treatment is cyclosporin or tacrolimus or voclosporin. Last one is the current medication is said to be superior efficacy, less toxic than the other two. You wait for a couple of days, maybe months. At times, you need to wait for 3 to 6 months to see its effectiveness. Then you they take the help of the third drug. It may be others IV cyclophosphamide, or you can MMF, or it can be rituximab, or even at times it is your levamisole and other medications. You combine three drugs, you call it triple therapy. No response of the triple medication, you call it triple resistance. You have more than four or more, you call it intense immunosuppression. No response, you have intense resistance. So finally, you have rituximab. Everything has failed. Combination of medications fail. You have the therapeutic trials in the West, but in our developing nations, we do not have any much trial medications. So you go for the newer options like ACTH, sparsentan, or you take the help of your plasmapheresis facts. Now, finally, you be reminded that you combine drugs, but use the safe drugs, use less toxic medications, and then you follow always the non-toxic pathway. Finally, at the end of everything, what is the outcome like? Around 70%, 80%, they do respond to 90% at times. They do respond to the medications, immunosuppressions, and a small amount of patients develop CKD, and very little amount of patients have as such they were proteinuric nephrotic state, and 1 to 2% patient death over here. So in our study at Bangabandhu Sheikh Mujib Medical University, our data says 76% response pattern, of which 68% complete, and another 7% partial response. And we have the third 12% CKD incidence and 3% patient loss.